Dr. Flanders, could you share a couple words on RSNA Ventures, what y'all are looking to accomplish and, this initial partnership?
The goal is really, to kind of look for new and novel ways to innovate, maybe develop some new technologies. And the thought was, what we should really do is collaborate with existing companies, particularly ones that are relatively agile, are very cool, very very hip to looking to developing new products. And so that's why we were really excited to work with Rad AI, because you kind of fit our requirements right off the bat.
We're definitely hip, so I appreciate
Yeah.
that call out. When I think about this partnership, what I think is really impactful is the ability to deliver the trusted information of RSNA at a scale in terms of point of care that's never achieved before. So taking the robust journal articles, scientific literature, making it actionable, and then integrating it directly into the radiologist workflow. So we were really excited, from our perspective, when we were approached for this partnership, because of that ability to, ultimately build a for radiologist by radiologist type workflow that can seamlessly integrate.
We already know RSNA has this really excellent content, and we realize also that radiologists now, of course, everybody realizes they don't have enough time to actually do formal lookups. Everybody goes to a web browser, looks something up on Google. It may take them to a full article. No one has time to digest that information, let alone the fact that, if there's small snippets of information out there, as was already brought up, how do we know the veracity of that information? Do we trust it? Is it good quality? Is it something I can actually transfer that knowledge into my report and feel like I've actually given, I actually passed on good, relevant, information to begin with. But years ago, we actually wondered, with all of the information technology was out here, and this actually came up long before LLMs were around or whatever else, we were thinking, wouldn't it be great if an EMR could pass a certain amount of information into some magical product where we could digest it and then deliver just relevant RSNA content back to the user that was just enough to get you to move on to your next step, realizing a lot of radiologists want to enhance their reports with information like a classification scheme that maybe they don't remember, or they're out of their comfort zone and they're basically delving into something they don't normally read, and they would normally call someone up to take a look at it. That's the whole idea about this is your companion. This is sitting on your shoulder saying, don't worry, I got you covered here, and anticipating your needs. I think, to me, one of the things that I think is phenomenal about where this product could go is if it follows along the logic of what the radiologist is doing while they're dictating a case, it will anticipate what your next needs are. Like you said, I think I see a traumatic lesion in the liver. The next thing you know, would you like to see the classification system for this? Would you like to see other examples of that in case you're unsure if this is a traumatic injury? Following along with what you're doing, but not taking up much of your time, just enough to help supplement your process. So, but back in the day, there wasn't good enough technology to allow this to happen. Really, the secret sauce is the middleware, and also being able to reconsume the content, or basically repackage RSNA content so we could deliver just the right nuggets of information. Not deliver a graph or something like that is not completely irrelevant out of an article, but something that you're actually probably going to use.